type, you see secondum type. Secondum type is the most common type, and premium type is not most common, but it is usually seen in Down syndrome. And we already know everything about foramen ovale and everything. So patent foramen ovale. Patent means open. If this foramen is open, we said that there's symptom premium and symptom secondum. They are two symptoms beside each other, and they are working as a one-way valve. And this valve is called foramen ovale valve, right? It is supposed to be open before birth because right pressure is increased, and right pressure pushes the door away and opens it. But after birth, it should be closed, right? Whenever it stays open, this is called patent foramen ovale. Failure of symptom premium and symptom secondum to fuse after birth. We said that those two symptoms should stick together after birth because of increased left pressure and decreased right side pressure. But after birth, whenever in 25% of population, these symptoms do not stick together and they do not fuse, they do not close. This is called patent foramen ovale, and this is very high, this percentage. I saw a question about the percentage. 25% of population has this patent foramen ovale. It means that the symptom premium and the symptom secondum do not fuse after birth. Most are asymptomatic. Of course, they are asymptomatic. And so in the question, how we are going to be tested with this, most are asymptomatic and remains undetected, can lead to paradoxical emboli. This is very high. It causes paradoxical emboli. What does happen with emboli? Venous thromboemboli entering the systemic arterial circulation through the right to left shunt. So whenever we say this is primary symptom, right? And this is secondary symptom, symptom secondum. This part is called one-way valve or foramen ovale. After birth, they should stick together and be closed. Whenever this is not closed, this is open. After birth, this is not good to be open, right? Whenever these two symptoms do not get together after birth and there is an opening in between, whatever comes to the right side of the heart goes to the left side of the heart because there will be a shunt in between. This is called patent foramen ovale. It means the foramen ovale is already open. So what happens? What is the harm of having a patent foramen ovale? Because we know that left side of the heart has increased pressure and does not let this door to open. So this door is already closed. What if there is a patent foramen ovale? There is no harm. But what is the harm? The harm is the risk of thrombosis, thromboemboli. What does thrombose mean? Thrombose means whenever the blood is clotting and making a thrombi. And we know when does the blood make thrombose? Just imagine with yourself that blood should flow and it should move. Whenever blood does not move and it stays in one place, this is called stasis of blood. Stasis. It means that the blood stays in one part of the vessel. It does not move. Whenever the blood is not able to move, it causes clot to form or thrombose to form. So which type of vessels are at risk of making thrombosis? Can anyone tell me? We have two types of vessels. One is vein and the other is artery. So is vein most prone to thrombi or arteries prone to thrombi or prone to clots? Arteries has a good muscles, has got a smooth muscle, and they constrict. Even if the blood doesn't want to move, the arteries push the blood to move, does not let thrombi to happen. But vein doesn't have good muscles, it doesn't have good smooth muscle, and the veins are compliant. Whenever blood stays, veins cannot push it, right? That's why the risk of thrombosis in vein is more than arteries. Of course, arteries also make thrombosis, like atherosclerosis and other things that we are going to study the mechanisms, but normally veins are more prone to thrombi. For example, if a patient is immobile and staying, because veins are sending the blood from down part of the body to the upper part of the body, like veins are coming from our legs to from our lower part of the body, like our legs and the GI system and everything comes to the inferior vena cava, and inferior vena cava brings blood to the right side of the heart. So blood is coming from down to the up, like from feet to the heart, right? Which side of the heart? We already said that right side of the heart has venous blood. Venous blood always comes to the right side of the heart. So whenever the vein comes from feet to the heart, from one side, the vein is not able to push the blood. From the other side, the gravity pushes the blood downside. So, and people who are immobile for a long time, like they're an airplane or they're immobile and after surgery or in the hospital, and that's why they usually immobilize the patient so fast. The reason why, because if the feet is immobilized, the blood will stay in the vein. Why? Because from one side, the gravity is pushing down, and from the other side, vein is not able to push very hard and send the blood to the heart. That's why the vein stasis. The vein stays in one place. Whenever the vein stays in one place, the blood stays in one place, vein is trying to make more space for the blood. And because veins are compliant, and when the blood gets all together and they do not move, the blood will start clotting. And this is called deep vein thrombosis. Right? There are lots of other risk factors for developing deep vein thrombosis. For example, those who are pregnant, those who are taking OCP, because estrogen is also decreasing the flow of the blood. So I mean, it will cause hypercoagulable state. That's why the thrombose will be made. Why I'm saying all these? Because we said that veins are more prone to making the thrombosis. This is called deep vein thrombosis. And this thrombosis made in the vein, and the thrombose from the vein should go to the right side of the heart or left side of the heart. Anyone can tell me? Veins travel to the right side of the heart or the left side? Right side of the heart, right? So if this thrombose is made in veins, right? If the thrombose is made in vein, this thrombose should go to the right side of the heart or to left side of the heart?
Right.
This should go to the right, okay? Right side of the heart, because we already said that veins travel to the right side of the heart, right? Now that veins are in the right side of the heart, from the right side of the heart, the vein should go to the lungs, or the blood should go to the left atrium?
Left atrium.
So
no, actually lung.
Yeah, normally it should go to the lung, because the blood from the feet, from the lower part of our body, the venous blood, all of them are collected and taken by inferior vena cava, and inferior vena cava brings all the venous blood to the right side of the heart, right? And the right side of the heart takes all these venous blood and sends it to the lung. Why does it send to the lung? Because right side of the heart tells to the lung that these venous blood doesn't have oxygen. We need oxygen, and I send it to you to make it oxygenated, and it is normal. This is called pulmonary circulation. Venous blood comes to the right side, and right side sends the blood to the lungs, and lungs oxygenate it and sends it back to the left side, right? So this is the normal circulation. But whenever there is a thrombi, this thrombus should also go to the right side of the heart, and right side of the heart should give this thrombus to the lung, not to the left heart. And this is called pulmonary embolism, right? So this is called pulmonary embolism. Like the venous thrombus comes to the right side of the heart, and from the right side of the heart goes to the lung and should make pulmonary embolism. Whenever there is a patent foramen ovale, whenever there is a hole in between left and right, this thrombus doesn't go to the lung. This one goes to the left atrium, because left atrium is more close. The thrombus says, why should I make my way forward? Why not to go to the system? Whenever this thrombus comes to the left atrium sends this thrombus to the left ventricle, and left ventricle sends the thromboid to aorta, and aorta sends the thrombus to system. If aorta sends it to carotid, it will cause a stroke, CVA. If aorta sends it to GI system, and wherever, to spleen, to everywhere, because aorta is sending blood to all the systems of our body, it will make, this is called paradoxical emboli. Paradoxical emboli means, what does it mean? It means that the emboli or the thrombus was supposed to go to the lung, right? But it changes the way to the left side of the body. So this is called paradoxical emboli, right? So how we are going to see questions regarding paradoxical emboli? The question will say, like, a young lady with no risk factor, with no hypertension, with no diabetes, with no risk factor, with no atherosclerosis, a young lady develops a stroke or CVA, cerebral vascular accident. It comes to the hospital with a stroke. You know that the reason for a stroke is thrombus. And people with atherosclerosis, hypertension, and diabetes has a stroke. Young ladies with no risk factor, why should a young lady with no risk factor have a stroke? We know we can consider this as paradoxical emboli. Why? Because this young lady, and in the question it says that a 25-year-old female taking OCP, and after a long flight, comes with a stroke. What could be the reason? The question asked like this: you know that 25-year-old female with no risk factor, no hypertension, no diabetes, how is it possible to develop a stroke or MI or those are risk factors for people with stroke? Happens in people with hypertension and diabetes, mostly with atherosclerosis, right? If a young lady with no risk factor develops a stroke, you should look at the other things, like the lady is taking OCP. So OCP has estrogen and progesterone, and estrogen makes the blood a little bit thick. It increases the risk of clot. So you see that this estrogen could cause a clot. Okay, this is one point. Another point is that long flight. For example, it doesn't say long flight. It says that the lady is coming from Asia to Europe or from Asia to USA. So this is a long trip. It means that immobility. The patient is immobile. So OCP is increasing the risk of clot, and the patient is immobile. So immobility and this OCP is causing, both of them causing stasis. Stasis where? Not in the arteries and the veins. And stasis in the veins is causing the clot. So we understood everything. So why now stroke? Stroke is in carotid arteries. This is a systemic artery. This is not lung. So even if this lady is young or taking OCP after a long flight made a clot, so this lung should go to the lung. The patient should come to the hospital with pulmonary embolism, because this clot was supposed to go to the lung, not to the system. So now this is the question asks you, what could be the cause of this stroke for this young lady? You will say that this would be paradoxical emboli due to patent foramen ovale. This clot was made due to OCP, due to long flight, due to immobility, and the veins travel to the right side of the heart, and the clot was supposed to go to the lung and make pulmonary embolism, which is also not a good condition. That is also medical emergency, but this clot didn't go to the lung. It was supposed to go to the lung. It came to the left side of the heart, and left side of the heart pushed it to the systems, and the system, and it went to the carotid arteries branches and caused the stroke. And the stroke also has long-term morbidity if it's not treated immediately, right? Does that make sense for everyone?
Yes, it makes sense. But my question is, if a young lady came with CVA, should we consider doing, like, she might have a ASD, which was non-symptomatic?
Yeah, ESD is also but ESD secondum type is mostly present in, like, it is most common, and even until age 65 and 75, people will not realize that it's not symptomatic. But we whenever we see that someone with no risk factor has a stroke, not only a young lady, even in men, you can also consider this. Whenever you see that a stroke happens in someone with no atherosclerosis, with no hypertension, with nothing, but there is a risk of DVT. At the same time, there is risk of DVT, and then because they were immobile, like they have either they have cancer, immobility, surgery, or a pregnancy, OCP. These are causing DVT. From one side, you see that these are the risk factors for DVTs. From the other side, you see that this lady or this man doesn't have any hypertension or atherosclerosis to cause a stroke, because we know that the stroke, the main risk factor, the most common risk factor for a stroke is hypertension. If someone has hypertension, he or she will develop a stroke. If someone doesn't have hypertension, he or she will not develop a stroke. So if a lady with no history of hypertension, with no history of atherosclerosis, and a lot of risk factor for DVT comes with a stroke, we should consider there should be a hole inside the heart, either ESD or foramen ovale. But mostly in questions, they ask about paradoxical emboli and foramen ovale. They either ask what could be the cause, you say paradoxical emboli. They will, in step 2, they used to ask, what are you going to do? Which lab test are you going to do? You will do echo, and not CT scan. We will do echo to find out. At first, we do CT scan to treat a stroke, of course, but for the follow-up, the question asked, what are you going to do to find the cause of this stroke? In order to find the cause of a stroke, we need to do echo in order to see if there is a hole not closed inside the heart of this lady. That's why it's causing thrombus from the right side of the body to go to the left circulation. Does it make sense now?
It does.
Any questions?
Yes, I have a question. So as far as I understood, if the septum primum doesn't close, it's ASD. But if and then septum secundum, it's supposed to close or no?
Septum secundum will close with septum premium. They will stick together, right? Because they are side by side like this. Before birth.
So if septum primum doesn't close, the septum secundum will not close or will close?
Yes, see like this. This is septum premium, right? This is septum secundum. Septum secundum is already blocking the way of the septum premium, right? It is already up to here. It doesn't let the blood to go from that ward. Even before birth, it is already closed. But the right side pressure pushes this door away like this. So they are already closed. If the septum premium is not made, imagine this is not made. There will still be some, because here is the endocardial cushion, right? If this part is not made, you will still see some way to from the right side to the left side. The septum will not be fully closed. The second septum will not be able to close all the way to endocardial cushion, because it is like this. This one is septum premium, and this is septum secundum. So you see that septum secundum, of course, it blocks the way of septum premium up to this part, not at the endocardial cushion. If you see that septum premium is not made, do you see that septum secundum is not able to close it up to this way? There will still be a way toward the other side. This is called ASD premium type. Did you understand it? Does that make sense?
Yes.
Your question is solved right now, right? And if on the other hand, this is septum premium, and this is endocardial cushion, and the septum secundum closes like this. If septum secundum is not made, this is called only septum premium will be left, and there will be a way from right to left. This is called ostium ASD secundum type, because the secondary septum is not made. Here, the primary septum is not made. You see that still there is a way, because the secondary septum cannot close all the way to endocardial cushion. Is it solved? Okay, let's go ahead. Patent foramen ovale failure of septum premium and septum secundum to fuse after birth. We said that septum premium and septum secundum should fuse together, and in 25% of population, they will not stick together. This will be a question. You need to remember this. And the other question from this part will be paradoxical emboli, a patient with no risk factor, and a lot of no risk factor for a stroke, and a lot of risk factor DVT comes with a stroke. So we need to work up as for this patient like a paradoxical emboli and ASD. So can lead to paradoxical emboli, venous thrombose entering the systemic arterial circulation through the right to left shunt. So means venous thrombose, venous thromboemboli, the thrombose which is made inside the vein, entering the systemic arterial circulation. The thrombose which is made in the vein was supposed to go to the right side and to pulmonary circulation, not systemic circulation. Whenever the thrombose from the vein enters the systemic circulation, how does it go? It might go through right to left shunt, as can occur in atrial septal defect and also patent foramen ovale, in both of them. So overall, whenever there is a connection between right to left, the thrombose from the right side of the body can go to the left and will cause problem like a stroke. Is it solved now? Did everybody understand?
Yes.
And now we can see the pictures. The pictures of prostate is not, I used to read it my way. However, I'm going to explain the same thing in the pictures of prostate. You see that this is endocardial cushion, and endocardial cushion is neural crystal that is migrating to heart and making a landmark for all the centers to develop. This is ostium premium, and septum premium comes and closes the ostium premium toward the endocardial cushion. And now this is, you see that this green is septum premium, this green membrane is septum premium, and septum premium, a part of septum premium starts to perforate and starts to regress and make a secondary wall, which is called ostium secundum. Once there is a connection between two hearts, this is a risk for after the birth. That's why from the right side, another septum, which is called septum secundum, comes and closes halfway of the septum premium. And now you see that this is this hole is called ostium secundum, right? And this blue septum is called septum premium, and the valve that is pushing to the left side because of the right pressure is called foramen ovale. And this blue part is septum secundum. We already know that. and the hole in between is called foramen ovale. It should close after birth, but when it is open, it is called patent foramen ovale. I hope I made it easy for you guys. This was the way I used to study. I respect whoever can use any method of studying, but it was so helpful for me and for my students, because the problem is that we understand it that day and we forget it the other day. That's why these concepts was so helpful in my journey. That's why I'm trying to pass it to others. And let's do a brief review about how the aorta and pulmonary is made, and the ventricles are made, and then we will read the text of first aid the next day. So